The trial enrolled over 500 patients. All patients, by protocol design, had received prior trastuzumab and pertuzumab. 91% of patients had received prior trastuzumab emtansine. The progression-free survival rate by blinded, independent, central analysis was longer in patients receiving margetuximab than those receiving trastuzumab, and this was statistically significant, although the clinical difference was only about 1 month. Similar data was found with investigator assessment of progression-free survival. Based on the hypothesis and the pre-planned exploratory subset analysis looking at IgG Fc gamma receptors, we found that by subset analysis, it looked like the CD16A alleles might impact the efficacy of margetuximab. So we analyzed this further. About 85% of the population has an F high affinity, lower affinity allele, whereas the remaining portion of the population are homozygous for the V high affinity allele. Prior retrospective studies have resulted in controversial data about the efficacy of trastuzumab based on the IgG Fc gamma receptor CD16A, F, and V alleles, with 2 studies suggesting that trastuzumab had less efficacy in patients who carried the low affinity F allele because of less binding, but 2 studies suggesting that it might not have made a difference. Obviously, these were retrospective subset analyses, and SOPHIA is the first prospective trial where we designed a substudy to look at the impact of these Fc gamma receptor alleles. When we looked at progression-free survival in the patients who were homozygous for the high affinity allele, it appeared that the results from margetuximab and trastuzumab were relatively similar for PFS. However, when we looked at patients who carried an F allele, it appeared that in this group of patients, the PFS benefit of margetuximab was amplified. And then when we looked at the patients who were homozygous for the low affinity allele, the FF group, versus the FV group who were heterozygous, it appeared that the effect was even further amplified.